Good afternoon, everybody. So the first lesson about the viral family that we will be having, or the viral group that we will be having, would be exanthemas. So exanthemas are what we call as viral exanthems. So when we say exanthemas or viral exanthems, the most common thing that they have is that rashes. May rashes, just like your measles, German measles, may rashes, except na lang, of course, with the mumps. Okay? So exanthemas can be uh, transmitted via respiratory or oral. Okay, so first thing we have the mumps virus. So mumps virus is probably originates from the old word mope, which is an apt of description for the municipal child affected by this common illness. So one of the first infections to be recognized and described by Hippocrates as early as 5th century BC. So they are related to the parainfluenza virus, an envelope virus with single-stranded RNA. So the virus has both the heme agglutinin or HA and the F surface antigen. Okay, so the disease is called as mumps. So for the clinical aspect, the onset is marked by malaise, fever, followed within 24 hours by painful enlargement of one of the or both of the parotid glands. So sa liog, may pain. The salivary glands are less often affected and swelling subsides with a few days. And of course, the recovery is eventful with inapparent infections to be common. So for the pathogenesis, the infection is spread in saliva and secretions from the respiratory tract and is acquired by the respiratory route. So incubation period is between 14 to 21 days. So viremia, or the presence of virus in the blood during the acute phase, is followed by generalized spread of the virus to the various organs, including the parotid gland. So the virus is shed for several days before and after the first symptoms, not just in respiratory tract but also in urine. So here we have an example where Jill partied with her friends, and poor Jill, because she has mumps, wala lang nakita, all of her friends already hate her. Next, for the mumps, we have complications. So complications may include orchitis or uh, swelling of your testicles. This develops in the absence of preceding parotitis that develops in 20% of males or contract mumps after puberty. That's why it is very dangerous for male after puberty to contract mumps kaya affected ang ilang testicles. So typically there is pain and swelling in one or both testicles 4 to 5 days after the onset of parotitis. So the pain is often severe enough to demand strong analgesics. There is also often an accompanying general reaction with high temperature and headache, and some degree of testicular atrophy follows 30% of cases, although sterility is often rare. When we say testicular atrophy, wala ganda ko itlog. Okay? It's not just about the males, but also about the females, because moms can also cause oophoritis, which is the inflammation of the ovary. So the inflammation of pancreas do not have serious long-term effects. Also for aseptic meningitis, higher than any acute viral infection of the childhood and almost always resolves without sequelae. We also have post-exposure encephalitis, which is more serious and carries unappreciable mortality. So this is also deafness because of the small residual complication in small percentage of the cases. For the immune response, patients produce specific antibodies such as immunoglobulin M, immunoglobulin A, immunoglobulin G, and follows the sequence usually for these acute viral infections. So there is also a cell-mediated immunity, which is probably important in the recovery process. For the combination, we have the live mumps vaccine, which are commercially available in combination of rubella and measles. It is called as measles, mumps, rubella, MMR. But the latest, we have the MMRV, or the mumps, measles, rubella, and varicella. Okay. So laboratory diagnosis, mumps can be isolated from infected saliva and from swabs rubbed over the Stenson duct from 9 days before onset until 8 days after parotitis appears. So ang imopirmigicaya nga clue is the parotitis. It can also be recovered in urine that That's why it caused your oophorytis and your orchitis kay malabot ka pa imo nga genitourinary tract. The virus is relatively fragile and should be handled carefully, and specimen may be examined directly by immunofluorescent assay or enzyme immunoassay. The virus can be isolated in the amniotic cavity of the embryonated chicken eggs, as well as primary monkey kidneys and human embryonic kidney cell cultures. Isolates can also be identified by heme absorption inhibition, IFA, and EIA. So paired sera can be tested for mumps antibody by FIAX, ELISA, IFA, and HI test. What do we mean when we say paired sera? If you can remember, we have the acute stage and the convalescent stage. Okay, so ang difference between the convalescent stage and the acute stage is that there is a 4 to 5 days apart specimens that can demonstrate diagnostic of fourfold rise in titer when tested by EIA or HI. Titer means antibody. So paired sera for CF tests should be taken at least 10 days apart, and viral isolation is preferable, but physicians rarely have trouble recognizing mumps. That's why normally if the patient has mumps, why na siya gina laboratory test, because signs and symptoms of mumps is already present, and the physician don't need additional confirmatory test for mumps. Next, we have your measles, which is derived from the Anglo-Saxon word "macelles" or the Latin name mobili, a diminutive of morbus, and that signifies a minor illness. In temperate countries, it is considered rarely serious and unpleasant, but in some tropical countries, it is a killer. Here in the Philippines, we already have several years. When we say several years before, but maraming years that it caused outbreaks. So this is another virus related to your para-influenza virus. So this is an envelope virus with a single-strand RNA. However, like mumps, your measles can confer lifelong immunity, and effective attenuated vaccine is also available. Once you've been infected by mumps or measles, lifelong immunity na ang katapat. So you will only have your measles and your mumps once in your life. Okay, so it has also an effective attenuated vaccine which is available. As mentioned earlier, it is MMR. So the disease is called robiola. Robiola. The rubella is German measles. Robiola is plain measles. So once most common viral disease of children, highly contagious, has abrupt onset and transmitted by aerosol. So signs and symptoms includes sneezing, runny nose, cough, red eyes, rapidly rising fever, and maculopapular rash. Take note, maculopapular rash. The period from infection to appearance of the rash is fairly constant at about 2 weeks, but maybe less by a few days. For the prodromal stage, these last 2 to 3 days with running eyes and nose, cough, and moderate fever. So careful examination of the buccal mucous membrane adjacent to the molar teeth may reveal your Koplik spots. Okay, Koplik spots. Koplik spots is the pathognomic criteria for measles. So once nakita si Koplik spots, automatic measles na siya. So these Koplik spots resembles the grain of salt just beneath your mucosa. So the rash first appears on the face and spreads to the trunk limbs within the next 2 days, and a dull red blotchy maculopapular eruption, usually characteristics enough to have its own designation, morbilliform. If severe, may have a purpuric appearance. So take note ha, if it's measles, halin sa kuya, panaog, measles na. The temperature may rise sharply to about 40 degrees Celsius, and every case there is evidence of bronchitis and pneumonitis with cough and crackles in the chest. So occasionally, there is also diarrhea in the early stage that indicates inflammatory lesions of the gut. So after 2 to 3 days, the rash starts to fade. For its pathogenesis, the initial replication takes place in the mucosal cells in the respiratory tract that is acquired via droplets. So there is a respiratory transmission of the virus. So there is also an acute generalized infection followed by a secondary viremic phase corresponding to the height of fever. The rash is not due to a direct cytopathic effect, but due to the reactions of the T cells against viral antigens appearing to the skin cells. When we say cytopathic effect, it is the result morphology of the cell after infected by a virus. So when you say cytopathic effect, pwede siya mag-spindle shape, mag-vacuolated, mag, uh, maggamay. That's a cytopathic effect. But the rash is not because of the cytopathic effect when we are talking about the measles, but due to the reaction of cytotoxic T cells. Because your cytotoxic T cells will go against your virus, which is present in the skin. So it's like a side effect that the rash appears. So the rash is a clear sign that a satisfactory immune response is in progress and that a recovery is already on its way. So your measles replicates in the local lymph nodes from where it spreads systematically. So the virus circulates in the T and B cells and monocytes until it eventually involves lungs, gut, bile duct, bladder, skin, lymphatic organs. So in acute and prodromal phases, virus is shed in body fluids, including respiratory secretions. Since it replicates in WBC, it also causes leukopenia. Clue na siya actually, guys. If there is fever, etc., and the WBC count is low, it also suggests for a viral infection. So virus-infected giant cells containing up to 100 nuclei have been found in the pharynx and tonsils, skin, respiratory epithelium, lymph nodes, and Peyer's patches. The virus-infected giant cells with 100 nuclei is sometimes as called as chunk cells. Sa chunk smear na siya. Kaya makita mo ang multinucleated giant cells. Okay? So the virus is widespread in the skin but disappears quickly in the onset of the rash and the appearance of circulating antibody. So we have the following complications for measles. For respiratory specimen, you have your croup, bronchitis, and giant cell pneumonia. For the eyes, of course, conjunctivitis and corneal ulceration. For the ears, otitis media, possible bacterial infection. Gut, enteritis with diarrhea. CNS, you have your febrile convulsion, post-exposure encephalitis, and subacute sclerosing panencephalitis. For immune response, you always have your immunoglobulin A, your immunoglobulin A, and immunoglobulin G that appears at the same time as the rash. So the first two disappears in a month while the latter persists for life. That's why you have lifelong immunity. So prophylaxis, you also have your passive protection, your normal human immunoglobulin in a dose sufficient to modify but not completely prevent measles, which is valuable for protecting debilitated or immunocompromised children that are exposed. However, we have the measles vaccine, which is the formerly inactivated vaccine, but it met with failure because of subsequent exposure, and some of the recipients developed unusually severe measles. The attenuated vaccines are, however, very effective and ideally are given in combination with mumps and rubella vaccines, usually 13 to 15 months of age, so no risk of neutralization by maternal antibodies. So it is better and attenuated rather than the formerly inactivated when we are talking about mumps. So the virus is also fragile and must be handled carefully. Specimens of choice from nasopharynx and conjunctiva. That's why we can do the throat swab. Direct examination using IFA or IAA is recommended. And just like your mom's, it can grow on your primary human kidneys. The virus isolates can also be identified by serum neutralization, EIA or IFA. And serologically, the EIA has replaced the complement fixation test. So demonstrations of measles-specific IgM in acute specimens is the best diagnostic test. After measles, we have the German measles, or scientifically known as rubella virus. So this is an enveloped virus with single-stranded RNA that belongs to the family Togaviridae. Diba ang imo mumps and imo measles is belongs to the para-influenza virus. So your rubella virus is derived from the Latin rubellus, that means reddish, and refers to the pink rash that is seen in most patients. This is written by German doctors, so the name as German measles. So the virus is sensitive to organic solvents, but not to freezing, thawing, or ultrasonification. So strictly a human virus, hindi mo siya makuha to other animals, but strictly from humans. So the mode of transmission is infected droplets and through placental transfer. That's why it is very dangerous for a pregnant woman to have rubella, because it can pass through the placenta and infect the baby. So it has an effective attenuated vaccine available and must be administered to all children and particularly to young women before they become sexually active. So the disease is German measles or rubella, and a mild febrile illness accompanied by an erythematous maculopapular discrete rash with post-auricular and suboccipital lymphadenopathy. For the pathogenesis, it starts on the face and spreads on the trunk and leaves. There is no rash on the palms and the soles, while your measles has a rash on the palms and soles. Normally, it occurs in the winter and spring, and as many as 50% of cases are asymptomatic. So there is also a transient polyarthralgia and polyarthritis that may occur in children and are more common in adults. So response, the immune response, specific IgM antibody appears within a few days of rash and is followed soon after by the IgG, walang IgA. The titer of IgM increases rapidly, reaching a peak of about 10 days after onset, and thereafter declining to undetectable amounts over several weeks or months. There would be little concern about rubella if it did not cross the placenta of pregnant women and disseminate to all fetal tissues. This is because the results range from the birth of a normal baby to a birth of a severely impaired infant to fetal death and spontaneous abortion. So the impact on the embryo is worst when an infected happens in the earliest stages of pregnancy because the effect of the virus, of rubella virus, to the cells is they halt or slow the growth of cells it infects. Thus, kung ara ka pa lang sa early stages of pregnancy, hindi mag-develop ang imo cells, hindi magdagko, hindi ma-develop ang imo nga fetus. That's why pwede mapatay or severely impaired ang imo nga baby. For the lab diagnosis, rubella virus is present in nasopharyngeal specimens or any secretions or tissues of infected infants who shed the virus in large amounts for long period. The direct examination of the specimen by IFA or EIA is recommended because isolation procedures are cumbersome and involve the use of a second or challenge virus. So serologic procedures are effectively because the presence of any rubella antibody is presumed as protective. Some actually, when you go abroad, like Australia or New Zealand, require pa sila some antibody to rubella as one of the requirements. So the most sensitive assays are solid phase assays, passive heme agglutination test. Latex agglutination and antigen-coded red blood cells test are also useful, but they are less sensitive. So after the MMR or the mumps, measles, rubella, you already have your Coxsackie virus types, which is a large subgroup of enterovirus. So your Coxsackie are divided into two, the group A and the group B, where in the group A, you have your herpangina or vesicular pharyngitis, hand, foot, and mouth disease, and of course, acute hemorrhagic conjunctivitis. However, the group B, you have your pleurodynia or the epidemic myalgia, myocarditis, pericarditis, meningoencephalitis, and severe generalized disease of your infants. If you have noticed, ang group A medyo mild lang siya or benign, but ang group B, ang ginakos niya are severe. So first, we will be discussing about the hand, mouth, and foot infection. So the pathogenesis, they are recovered from the blood of early stages of natural infection. The virus is also found in throat for a few days early in the infection and in the stool up to 5 to 6 weeks. Okay, di ba? Upod na siya. This one, hand and mouth, upod sa imo nga baboy, baka. We also have your enterovirus type 71, which are naked viruses with single-stranded RNA. These are the causative agent of hand, foot, and mouth disease, generally disease of the young children. So the mode of transmission is by fomites and by oral fecal route, characterized by malaise, headache, and abdominal pains. So suddenly, small painful sores appear on tongue, buccal mucosa, and soft palate. So simultaneously, a maculopapular rash appears on hands, feet, and buttocks, followed by the bullae on the soles of the feet and palm of the hands. So the lesion regress in about a week. If there is a rash, it is transient. This can also be isolated from mouth swabs and swabs of the bullae, hand, foot, and mouth disease because makita lang ang iyang mga distinguishing characteristics or signs and symptoms or the rash on mouth, hands, and feet. Pero sa baboy kag sa baka, foot and mouth disease na siya. Gets yun na nga. Okay? Next, after we have the B9 or the parvovirus, B19 or the parvovirus, B19, hi, it's not B9, a small naked virus with single-stranded DNA, the only single-stranded DNA virus, which is also known as depenovirus because it needs a helper virus, either adenovirus or herpes virus. So it is resistant to liquid solvents but sensitive to extremes of pH and heat. It is called as the fifth disease or the infectious rash erythema infectiosum. So named because it was the fifth infectious rash discovered. First was measles, then your rubella, then scarlet fever, then exanthema subitum, and the fifth one is your erythema infectiosum or the B19 parvovirus. This is a mild febrile illness with lymphopenia and a transient rash that lasts only a couple of days. So there is a maculopapular rash over the malar areas, and during the period of infection, erythropoiesis stops, creating an aplastic crisis in anemic persons that may require transfusion. So there is a high risk of fetal death if B19 infects a pregnant woman. So the portal of entry is a respiratory tract. And during viremic phase or the stage of infection, your erythroid precursors are lost. Erythroid, that's the precursor for your RBC. Your reticulocytes disappear. Lymphocytes, neutrophils, and platelets decrease, and no precursor are seen. That's why may aplastic crisis, especially for anemic patients. So within about a week, the patient returns to normal, and DNA probes detection of B19 are available from the laboratory involved in research. Sadly, wala na di sa Pilipinas. So for the pathogenesis, incubation period is 13 to 18 days. Primary infection of the upper respiratory tract and viremia that lasts for a week. So the virus is cleared in the appearance of IgM and IgG antibody, and rash and arthropathy are immunologically mediated. So for the diagnosis, we have the detection of IgM antibody by ELISA and radioimmunoassay. We can also check the virus for electron microscopy. Okay, so far we only have exanthemas and introduction to virology that will be included in your midterm examinations. Okay, if you have any questions, please feel free to message me so that we can answer it on our chat box. Thank you.